I am Dr. Wayne Whalen, and I am proud to introduce best practices recommendations for chiropractic management of patients with neck pain. We believe this paper will be of immediate practical use to all doctors of chiropractic, as well as other stakeholders. Neck pain is one of the leading causes of disability and frequently leads to chronic neck pain. This best practices document provides a guide for how neck pain can and should be evaluated and treated using conservative approaches typical of most chiropractic practices. The goal of our best practices document is to help doctors of chiropractic provide better care and to help payers and regulators understand what best practices in the chiropractic care of neck-related conditions looks like. While there are excellent clinical practice guidelines in the literature on neck pain, our paper offers a unique perspective. Existing CPG rely on the highest quality evidence, such as systematic reviews of randomized controlled trials, but for a number of reasons they leave gaps in their recommendations, or the recommendations conflict with other CPG. We use the best available scientific evidence, including 3 recent clinical practice guidelines, to inform the framework for our document, and where there were gaps in the evidence or conflicts between those CPG, we used a modified Delphi process with more than 50 experts from all over the United States to rate recommendations and develop a professional consensus. As a result, our paper will provide readers, including providers, payers, and regulators, with reliable advice on which to base practice decisions derived from the best available scientific evidence. Most providers will be familiar with most of our recommendations. First, obtain a thorough history. Conduct a condition-relevant examination. Evaluate for potential red flags or yellow flags. Obtain imaging studies as appropriate. Develop a plan of care and obtain consent to treat. Look for factors which might delay recovery. Develop a diagnosis or differential diagnoses. Provide appropriate patient reassurance and home care advice. Determine whether co-management or referral is indicated. Treat in brief 6 to 12 visit trials and evaluate for treatment effectiveness. Consider appropriate referral, including for psychological evaluation. Determine whether the patient is improving, worsening, or has plateaued at each visit, and discharge as indicated. Document subjective and objective findings and the clinical decision-making process. In summary, we provide an easy-to-follow, evidence-based approach to evaluating and caring for neck pain patients. Our paper also reviews the evidence for commonly used modalities and procedures, and the most robust evidence favors multimodal care, which means manipulation, mobilization, and exercise, although there is evidence to support the use of TENS, massage, low-level laser, acupuncture, and other treatments. We review treatment frequency and scheduling and recommend, in general, short trials of treatment, typically 6 to 12 visits, with further care predicated on demonstration of functional improvement. Use of outcome assessment tools is recommended, as is collaborative care with other provider types. We believe these best practices are based on the best available scientific literature and will help clinicians and other stakeholders in identifying and supporting appropriate conservative care of neck pain. Thank you.